there's been a request from practitioners to be able to come and have a taste of some of the sorts of things that students experience in the intensives that we hold at Metavision, in the training, in the holistic counselling and psychotherapy training that we do. And so I thought it would be great to have a 3.5-day retreat at the same place where people can live in, or they don't need to live in, they can live out, but we have a number of days where people build community, networks, and have a professional development focus. And the one that we're wanting to do this time, coming up in spring in the Southern Highlands, it's a great time to come, is on working with body awareness and body symptoms and the dreaming and finding purpose and meaning in life through the dreaming processes. And what's interesting is that this was the development of the retreat direction, and then a report has come out very recently, funded by the Department of Health and Ageing, into recommendations for evidence-based practice around the treatment of complex trauma. And what they're saying is very much in line with the sorts of things that we're doing in the training at Metavision, and particularly around being able to work with the body and body awareness and finding meaning and purpose and developing attunement and connection, relationship and trust. These are the sorts of things we'll be looking at in this professional development training. Working as a therapist in any capacity, it can be, complex trauma is a very interesting subject to have studied, because it actually often pervades many conditions that counsellors, psychotherapists, psychologists, social workers, and many allied health professionals and complementary therapists see. And are not necessarily recognised as such, because complex trauma leads to a lot of symptoms, especially childhood trauma manifests as symptoms later in life. I think we're trying to bring an environment that's first of all nurturing and supportive of them, because when you're working with people with trauma, for example, or illness or problems of any sort, then it's always it's a demand for the therapist. So the therapist needs self-care. If you learn how to nourish yourself as a therapist, you can also encourage the client to develop their own ways to self-soothe and support themselves. So it's an experiential, there's a strong experiential component. We do movement, artistic activities, as well as information around working with the body and working with body symptoms. This is arising from the work of Arnold Mindell. He had he's developed the process-oriented psychology, and he developed what he first called a notion of the dream body, which is understanding that dreams and the body and body symptoms have a connection. And he's developed that on to have wonderful ways of working with both the body awareness, body symptoms, dreams, but connecting also with the deep stream, the deep current that runs and helps to organise each individual life that has a teleological movement in it towards something with purpose and meaning. It's not the something that's important, it's the movement. So we'll be working with those sorts of things, and participants in the workshop, in the seminar rather, will be able to take away their own experiences of working in that way and skills to work with their clients too. So it's good for people working in the complementary therapies as well as in the psychological practices and in allied health.